My name is Benjamin Bleier. I'm a professor of otolaryngology and head and neck surgery here at Mass Eye and Ear. I specialize in rhinology, which is effectively patients that have disorders of the nose and sinuses. So I see patients with complex diseases of the sinuses like chronic rhinosinusitis, as well as diseases of the skull base, where I do complex endoscopic skull base and endoscopic orbit approaches. My bench research focuses on two areas. The first is developing new targets for the treatment of chronic rhinosinusitis, as well as new therapies for that disease. I also have developed new approaches to deliver drugs to the brain through the nose, and this is for diseases like neurodegenerative disease and also tumors of the central nervous system. I also hold multiple titles within the department. I am the Director of Innovation and Commercialization, I'm the Director of Endoscopic Skull Base Surgery, and I'm also co-director for the Center for Thyroid Eye Disease and Orbital Surgery. Most recently, I was promoted to full professor of otolaryngology and head and neck surgery at Harvard Medical School. I grew up outside of Philadelphia, Pennsylvania, and I actually did all of my training in Philadelphia at the University of Pennsylvania. I started there as an undergraduate in 1996 and went to medical school there in 2000, moving on to my residency in otolaryngology head and neck surgery. I finished there in 2009 and went on to do a fellowship at the Medical University of South Carolina between 2009 and 2010 in rhinology and endoscopic skull base surgery. After that, I came up here in Boston in 2010, and I've been here ever since. Outside of the hospital, I spend most of my time with my two young daughters. I like racket sports, in particularly tennis, as well as most recently pickleball.